you will be shocked to know that every 10 kg extra weight reduces your lifespan by 2 to 4 years. Dietary and lifestyle modification is the cornerstone of entire management of obesity.
Welcome to our series, Uncover GLP-1s, and I'm here with Dr. Anshuman Kaushal, and we'll speak about obesity, weight loss, and treatments like GLP-1 and surgery. Dr. Anshuman is a robotic and bariatric surgeon and obesity expert at Indraprastha Apollo Hospitals, Delhi. And I'm Parth, co-founder at EarlyFit, a holistic GLP-1 based weight loss provider. Weight loss plans have existed for 50 plus years, yet India has over 135 million obese people. So what's going on? We'll find out today.
Thanks for having me, Parth. It's an absolute pleasure being here with you today.
Thanks for gracing us, Dr. Anshuman. So shall we dive right in, Dr. Anshuman?
Sure.
So EarlyFit sees a lot of overweight clients, right? And these are people who really blame themselves. They have shame that in themselves that they are overweight. What do you say to such people?
It's a very pertinent point, Parth. I see a lot of people in my daily clinics who are coming to me with a lot of hesitation and a kind of subtle guilt. So let me tell you that obesity has been classified as a disease by World Health Organization. It's a medical condition, and that too a chronic relapsing neurometabolic disorder, which has been made worse by other factors such as your biology, which includes your genetic makeup as well as the hormonal factors. Also, the environment in which we live in contributes a lot in magnifying this problem, because as you can see nowadays we have got so much luxury. We have got amazing apps which can deliver food at the drop of a hat. Also, the mobility has been restricted, and this has coupled with a lot of stress, social stress, work pressure. So I guess in totality, all these factors makes it a chronic neurometabolic condition.
So people really think it's laziness or it's the lack of discipline, and that is the blame that they're coming from. So is it a medical condition or is it laziness?
You have hit the right spot. Unfortunately, I would say there are a lot of cultural factors. There is also a moral framing where people associate obesity with the lack of discipline. Also, culturally, traditionally, it is our thinking that plump means affluence. That is also one of the factors which leads to this particular thought. So those are the also obesity is something which cannot be diagnosed like as a value. For example, diabetes, your blood sugar will be raised. In hypertension, your blood pressure will be raised. Whereas in obesity is just your external appearance. So traditionally, people they are hardwired to think or perceive obesity in a manner where it reflects that probably you are not serious enough, or there is a lack of discipline on your part. So that is the main problem.
I think you hit the nail on the head. So you mentioned that there is no way to really diagnose obesity, right? They say HbA1c is a diabetes metric. Do you think that we should start using waist circumference or something more actively in diagnostics to tackle or measure or diagnose obesity?
Absolutely. So in the past, the BMI, which is your weight in kgs divided by your height in meter squared, used to be a marker of obesity. But now Lancet has proposed a new classification where not only the BMI but also the anthropometric measurements like your waist circumference has become a very important tool in diagnosing the obesity. So now the obesity has been classified as preclinical and clinical, or I would say stage 1 and stage 2 as per ICMR data, where if your BMI is above 23 and your abdominal circumference, if it is more than 90 centimeters in male and 80 centimeters in females, it constitutes obesity. On top of that, if you have a comorbidity like blood pressure, diabetes, non-alcoholic fatty liver disorder, infertility, or similar problems, then some intervention needs to be made. So definitely yes.
Love it. Check out our BMI calculators and also our waist to hip circumference calculator in the description below. Dr. Anshuman, you also mentioned that wealth is often associated with obesity, right? जैसे हमारे यहाँ पे बोलते हैं खाते पीते घर का है, right? There's also cultural element here. For example, I lost a few kgs when I was gymming. I increased a bit of muscle mass, reduced my stomach a little bit. And my was like, तुम तो कमजोर हो गए हो. So, you know, when you become healthier, तुम कमजोर हो गए हो. When you actually gain weight, तुम healthy हो गए हो. So, what do you have to say about those cultural elements when it comes to what you see around yourself?
That is very true. I have seen in my surgical practice, then when we do bariatric surgeries and patient, they start eating less, then it's not the patient but their family members who comes to me and then looking worried that अभी तो ये इन्होंने खाना ही बंद कर दिया है. Because in our society we associate food with love. You know, if I love you, then I'll offer you food, then I'll force you to eat. So these are cultural practices which shapes human behavior. So yes, that is one of the problems. But we have to understand that metabolically obese and physically fit is quite dangerous. So we have to understand that though may you look lean and thin from the outside, but if you are medically or metabolically obese, then the problem is a significant one which needs to be intervened.
Love it. But no, जैसे घर में मेहमान आए आपके, right? एक और रोटी ले लो, एक और रोटी ले लो. ये इतना often होता है.
We all have faced this problem, and unfortunately, if when you say no, you are offending your host. So at times you come under societal pressure, and you end up eating more. So what I would say is you have to be firm and polite, and always you have to be very careful about your health, and definitely we cannot correlate love and affection with food. So that mindset needs to be changed.
Yeah, but to your previous point, I had a relative who had they were undergoing mental health issues, and they ended up losing about 10 kgs or so. But they were at like 95 with a BMI of 30. And they suddenly became really worried and say, यार मेरे 10 किलो lose हो गए हैं, मैं तो बहुत कमजोर हूँ. They came to me and they're like, put me on some weight gaining routine. How do I should I go to get some weight gaining powder, some protein powder? What should I get? I'm like, this is not what you want to do. You don't want to gain back this weight. Sure, the reasons that you lost weight were probably not the right reasons. It happened because of your mental health. But now that you've lost the weight, it's okay. Treat that as your new set point. Do you think my advice to them was right?
Yeah, absolutely. I would like to add few things here. See, there is a difference between healthy weight and unhealthy weight. Weight gain primarily happens because of increase in the fatty content. And if the weight is because of the muscle, that is something which is desirable. So when you are supposed to lose weight, you have to do it in a right manner under proper supervision of a physical trainer as well as a nutritionist as well as a doctor, because what we are aiming here is to lose the fat and at the same time to maintain or gain muscles. So that is very, very important here, that you are not gaining because of fat and you are not losing because of muscle loss. So there has to be a right balance, and that is why the definition has been changed, and the fat distribution has become a very, very important parameter to stratify the obesity.
We hear a lot about genetics, hormones, metabolism. कि अरे ये तो कुछ भी खा ले इससे तो चढ़ता ही नहीं है, और मैं तो पानी पी लूँ तो भी मैं मोटा हो जाता हूँ. So is slow metabolism real? Is it a thing?
It's a very good question, Parth. Often I see in my practice patients coming to me with obesity telling that they are plain unlucky. They don't eat much, still they are gaining weight, whereas the other people, they are not active, and despite eating more, their weight is maintained. So let me remind you that obesity is a multifactorial disorder. There are a lot of factors which may lead to this problem. One of them is lack of activity or a sedentary lifestyle. Now what happens because of your sedentary lifestyle, Also because of age and other factors, you may lose muscle or you may have less muscle. Now, muscles are the furnaces of the body. They causes a decrease in the basal or resting metabolic rate. Now, that is also one of the reasons for a person to gain weight. Another reason can be wrong type of food, eating at the wrong time, and also there are genetic compositions which may predispose a particular individual to gain weight. There are a lot of hormonal influences, your lifestyle, if you are under stress, if you are addicted to alcohol or smoking, all these things raise cortisol, and cortisol again will cause gain in weight. So in totality, we have to assess a person, and I would say it's not bad luck, but it is a combination of factors, and each and everything is modifiable as of now. So definitely, in a way, people, they are not unlucky. There are a lot of issues going on, and we have to take care of each and every issue separately.
Got it. Absolutely. Obesity is a holistic environmental ecosystem problem. But you also mentioned a measurable indicator there. You just basically briefly mentioned basal metabolic rate.
Right.
Can you tell us more about it?
So basal metabolic rate means the energy expenditure by your body when the body is at rest and for normal physiological purposes. For example, you are digesting food, you are breathing, a lot of thermogenesis is happening inside the body. So that needs calories. So that is your basal metabolic rate. Now we have to understand if the body composition comes into picture here. So those people who have got more muscles, they have got automatically their basal metabolic rate is higher. So they will burn fat or energy at a faster rate than people who don't have muscle and more of fats. So that is one of the reasons where this particular factor becomes very important.
Got it. देखो BMR मैं समझ गया, ये एक indicator हो गया of how to measure metabolism or factors behind obesity. What treatment options are available to someone who is obese?
Okay, so as a medical professional, first and foremost, we have to screen the people and stratify them. Now, we have already discussed how we stratify the people, and then we have to plan a treatment for them. So, if your BMI is less than 23, and if your waist circumference is less than 19 males and 18 females, then you have to maintain your lifestyle and you've been doing good. So you have to carry with that. However, if your BMI is more than 23, then you are classified as overweight. Now, this is the time when you have to make necessary changes. Otherwise, eventually you have got a very high risk of developing comorbidities like insulin resistance, metabolic syndrome, diabetes, even cancers. So for people who have BMI more than 35 with comorbidities or BMI more than 40 without comorbidities, the bariatric surgery has proven to be a most effective solution, because here we are not looking at only the loss of weight, but also to maintain that loss. So studies have shown that once you cross a BMI of 40 or 35 with comorbidities, then it becomes the best option. However, for people who have BMI more than 27 and less than 35, now that particular group of patients gets maximum benefit out of pharmacotherapy. And now we are seeing GLP-1 analogs and GLP-1 and GIP analogs, and the results are pretty promising. So I would say for those people who falls in the BMI of 27 to 35, these drugs are a boon for them.
So basically what I'm hearing is it's a spectrum. It depends on the people, it depends on your specific circumstances.
Right.
And to always discuss with your doctor. But largely the spectrum is under 23, you're doing great. 23 to, I want to say 27, diet and exercise, do lifestyle modifications.
Yes.
27 to 35 or 27 to 40, depending on comorbidities, maybe pharmacotherapies like GLP-1s. And above 35 or above 40, depending on, again, comorbidities and discussing with your doctor, bariatric surgery?
True. So studies have shown that these GLP-1 analogs, they have shown a weight loss of up to 15 to 20% over a period of 72 weeks. And bariatric surgery has shown results of somewhere between 25 to 30% of weight loss over a period of 1.5 years. So again, once we stratify our patient, we decide what is the right treatment for them.
Okay, so GLP-1 medications, right? What are they?
So GLP-1 analogs are, these are the talk of the town. GLP stands for glucagon-like peptide 1, and it's a hormone which is primarily formed in your brain and your intestine. Now these drugs, they mimic GLP-1, which leads to loss of appetite, your cravings are reduced, and at the same time you will feel full for a longer period of time. It slows down your gastric emptying, and also it makes you more insulin sensitive, thereby increasing your metabolic rate. So by these actions, they have shown very good results, and people, they are losing between 10 to 15, even up to 20% in case of Tirzepatide, which is a GLP-1 as well as GIP analog, over a period of 72 weeks. So yes, I would say these medications are a bridge in the management of obesity between dietary and lifestyle modification and bariatric surgery.
In that case, what are the types of bariatric surgery?
Bariatric surgery, you have to understand that bariatric surgery is not a cosmetic surgery. Bariatric surgery is done to enhance your lifespan. It is a surgery to take care of a life-threatening problem called as obesity. It is not a cosmetic surgery, or it is not a surgery meant to enhance beauty. That we have to understand. Now in bariatric surgery, what we do, it is primarily divided into two types. One is restrictive and other one is restrictive plus malabsorptive. Now I'll just simplify this for you. In restrictive or sleeve gastrectomy, we reduce the size of the stomach from 1.5 to 2 liters to 80 ml to 100 ml.
Wow.
Now what it does, it reduces the amount of calories in the food you consume, and it will make you feel full very early. Also, the portion of the stomach which release a hunger stimulating hormone called as ghrelin, that portion has also been removed in this surgery. So you will feel early satiety. Now this is how a sleeve gastrectomy works. In gastric bypass, which we prefer in people who have got high BMIs along with disorders like uncontrolled diabetes, here we also add a component of malabsorption. We reroute the intestine, so you eat less and you absorb less. So by this double action, you not only lose weight, but also there is a significant reversal of these comorbidities. I must add here that these treatments require lifelong commitments, as well as in cases of bypass surgery, we put our patients on lifelong nutritional supplements as well.
So before getting a surgery, what would you advise a patient to do?
First of all, we ensure that this patient is a right candidate for a procedure. So we do a full metabolic assessment, a full psychological assessment. We also discuss it with other family members that a support system is needed. Also the commitment, and we also screen our patients for addiction, because if you are addicted to alcohol or smoking, then these things eventually are gonna create a problem for you. So once we do a proper screening, we will decide what treatment is right for you, what kind of surgery is recommended. If you have comorbidities like diabetes, then maybe a gastric bypass will help you. Otherwise, a sleeve gastrectomy might suffice. So based on your profile and based on your preferences, the treatment is tailor-made according to an individual.
What are some other diagnostics or labs that you end up doing with patients before you put them on something?
So what we call as a metabolic panel or metabolic testing, which has become very important these days. So we start with the anthropometric measurements, BMI, your waist circumference, your waist hip ratio, waist to height ratio. So these parameters tells about the distribution of the fat, which becomes the cornerstone in diagnosis of obesity. Then we use certain adjunct testing, basically blood testing, where we will check your lipid profile, your thyroid function test, your fasting insulin levels, your fasting sugar levels, also fasting insulin, C-peptide, and there is a special test called as HOMA-IR. In addition to these blood tests, we also go for radiological mapping, and we get the ultrasounds to check for non-alcoholic fatty liver disease or a DEXA scan. And nowadays, MRI also helps in knowing the distribution of the fat. Plus, recently we have also incorporated genetic testing.
Wow.
As you know, obesity is a polygenic disorder. So, by doing a genetic testing, we can identify people who are at risk, and we can do a primordial level of prevention in those people who have those genes responsible for slower metabolism, or those who can have this tendency to gain more weight. So that is one. Also, microbiome or microbiota testing is something which is emerging in a big way, where we can identify people who have more propensity to gain weight. That is another. And another test is resting energy expenditure or indirect calorimetry, where we can quantify the amount of energy which you are burning at rest. So all these tests in totality gives us a brilliant picture of a person, and we can make interventions accordingly.
Wow, that's a lot of tests. So just to whoever's listening, to make it clear, you don't need to do all these tests. It's only on specific circumstances.
Absolutely.
Dr. Anshuman, right?
So again, we have to quantify, we have to basically stratify the problem. We have to define the magnitude of the problem, magnitude of the obesity, and depending on what stage you are at, the tests are advised accordingly.
You mentioned a really special test in there that we certainly end up recommending to everyone who visits us, which is the fasting insulin test, and very few people know about it.
Yeah.
Can you speak a little bit more about
that? The event which leads to obesity is what we call as insulin resistance.
Correct.
So we have to understand that because of our inadequate diet, high carbohydrate diets, junk food, it leads to constant bursts of insulin release in our body throughout the day. Now, because of this, the body adapts, and eventually it will require more and more insulin. Now, more and more insulin, eventually the body cells become resistant to insulin, and then the fat deposition occurs. So we have to quantify that, and the fasting insulin levels and the C-peptide levels help us in knowing how resistant we are to the insulin, and accordingly the management can be decided based on that. So it is a very important test.
Yeah, certainly. I feel like diet is one of the most important factors that leads to insulin resistance. And someone actually really close to me has insulin resistance, and she consulted dietitians, and they were like, "Mithai chhod do, meetha chhod do." But it's festive season. Do you recommend meetha ekdam chhod do? Does that work?
Parth, this is totally unreasonable for experts to say ki meetha chhod do. I would say that the poison is in the dose. So the portion size becomes very important. How frequent you indulge in these things becomes the most important thing. So anything, if done in moderation, will not cause any problem. However, excess will lead to obesity. So my suggestion to all the people who ask that mithai nahi khana hai, ya when they are given such advices, unreasonable advices, which is impossible to follow, I would say, सब खाओ, लेकिन moderation में खाओ. The poison is in the dose.
पर अब तो शुगर फ्री मिठाइयाँ आ गई हैं, शुगर फ्री चॉकलेट्स आ गई हैं. Everything is now available sugar free. So stevia हो गया, monk fruit हो गया. Those should be healthy.
Unfortunately, there is a problem with sugar free substitutes also. Aspartame जैसे substitutes are linked to many metabolic issues, many problems. There are certain natural sweeteners like stevia or monk fruit, which in moderation are good, but again, they are not free from problems. If you are taking sugar free on a daily basis, it confuses your body. The insulin will be released in anticipation, thereby leading to insulin resistance. So again, in moderation, it is acceptable, but not on a regular basis.
Got it. So to summarize that, I have sugar-free chocolate. My body thinks that I'm having sugar, and it releases a bunch of insulin, and that because incremental additional insulin is released, my cells now become less sensitive to insulin. That causes insulin for them to become insulin resistant, and that in turn leads to prediabetes and diabetes.
Absolutely. You are absolutely right.
So medical treatments for obesity have both benefits as well as risks. How do you counsel patients about it?
Wonderful question, Parth. We have to understand that even taking a paracetamol has its own risks. So we have to basically weigh the risk of taking medications vis-a-vis risk of inaction. Obesity per se is a risky business. There are so many things which can happen, or I would say obesity attracts so many problems, not only metabolic disorders like hypertension, diabetes, but also certain kind of cancers like breast cancer, uterine cancer. And you will be shocked to know that every 10 kg extra weight reduces your lifespan by 2 to 4 years.
Oh, wow.
So obesity is a disease which directly reduces life expectancy. So having this point in mind, definitely the pharmacotherapy versus obesity, pharmacotherapy is a lesser of the two evils. The risks and the benefits, if we measure both the things, then definitely the benefits far outweighs the risk. Of course, they are not free from risk, but majority of the risks are minor. For example, nausea. We see in 30 to 40% of the people taking GLP and GLP-1 and GIP analogs, nausea is the most frequent problem, but over a period of time, it settles down. So I would say it's a relatively minor problem. In addition, people, they also have constipation, bloating, diarrhea, and most of the problems are minor. There is a subset of people where we do not prescribe GLP-1 analogs. For example, in pregnancy and lactation,
Correct.
in thyroid malignancies or thyroid cancers, or in conditions like type 1 diabetes. So except these few patients, these GLP-1 has shown a very promising result.
No, absolutely. In our practice, someone had a risk of pancreatitis and our doctor said absolutely no, right?
Yeah, studies have shown no major risk of pancreatitis with GLP analogs. However, as a precautionary measure and as a label warning, we avoid giving these medicines to people who have a history of pancreatitis. However, we need more studies, more research. Researches are being done, and we are waiting for the data to emerge. Definitely, but for now, we are not giving these medicines to people with history of pancreatitis.
Got it. And we certainly covered a lot of risks, right? Like nausea, bloating, diarrhea, vomiting, that could happen. Some of the benefits. So recently, semaglutide GLP-1 was approved by FDA for obstructive sleep apnea, was also recently approved for liver, fatty liver issues, right? We know that it's great for cardiac health, diabetes. So what are some of the other non-obesity related benefits for GLP-1 therapy?
Absolutely. So you have rightly pointed out, semaglutide has shown improvement in cardiovascular disease profile. Also, by virtue of reducing weight as well as by directly affecting the organs, these drugs have shown very good results, especially on cardiometabolic parameters. So yes, I would recommend these drugs in people who are candidates for them, and it not only reduces weight but also improve other parameters as well.
Correct. So we discussed risks of GLP-1 therapy. What about risks of bariatric surgery, and how do they differ from what they were like 15 years ago to today?
Like I said before, with technological advancement, good anesthesia, and improved instrumentation and technical expertise, the bariatric surgery risks have gone significantly down. Especially, we are also doing robotic bariatric surgeries. So the risk of a bariatric surgery procedure is equal to a surgery like a laparoscopic gallbladder removal or a laparoscopic hernia, except in those patients where there are multiple morbidities or BMI is extremely high. So we always optimize our patients before considering them for surgeries. We also start pre-surgery GLP-1 analogs in certain subgroup of patients to make them more suitable for bariatric surgery.
What is the difference in effectiveness of bariatric surgery versus GLP-1?
Like I said, bariatric surgery as of now is the most effective treatment modality for people who have BMI more than 35 with comorbidities or BMI more than 40, because we are not looking at only weight loss, but we are also looking at the sustainability. So long-term studies have shown that the results of bariatric surgery over a period of 5 to 10 years are the most sustainable. But we need more data on these medicines to endorse them for long-term results. But as of now, bariatric surgery is the only effective mean of controlling as well as maintaining loss of weight.
Completely agree. I feel like even with GLP-1s, once you end up finishing your course, you certainly need to maintain those lifestyle modifications, which is where EarlyFit, I feel, makes sure that you have the right nutrition, you work out, you end up inculcating good habits through our app. And we continue our support even after someone goes off GLP-1s. At the same time, if there are no lifestyle modifications at all and you mean revert to your previous self, that weight could certainly come back with GLP-1s. But with bariatric surgery, what I'm hearing, Dr. Anshuman, is that it is more sustainable. I also want to here ask a nuanced question, right? People feel like the Allurion balloon procedure is also bariatric surgery, and I've heard that there is risk of the weight coming back after that. So how would you distinguish that from bariatric surgery, and how would you specifically talk about the risks of weight coming back with the Allurion procedure?
Okay, Parth. See, dietary and lifestyle modification is the cornerstone of entire management of obesity, be it bariatric surgery or Allurion or pharmacotherapy. So, even if you have bariatric surgery, you can regain weight if you do not follow the dietary and lifestyle modifications as suggested. So we have to understand that the cornerstone of therapy has to be dietary and lifestyle modification with a lot of discipline. Now coming to Allurion balloon, now it's a novel procedure where you swallow a pill. It's a large pill which you swallow. It's an office procedure, and once it goes inside your stomach, it inflates to a 550 ml capacity balloon. Now, over a period of 5 to 6 months, a person would lose somewhere around 10 to 15% of the body weight. Again, if you do not follow dietary and lifestyle guidelines, people have shown weight regain, and they have also shown weight regain once they stop GLP-1 analogs. So again, dietary and lifestyle modification is the cornerstone, and rest other options are more of a tool. So I would say that all these options, be it Allurion, be it GLP-1 analog, or be it bariatric surgery, these are all means to an end and not the end in itself.
So obesity has a lot of effective treatments now, but they're also expensive. How do you help users sift through the costs of medication, the cost of surgery?
You have just hit the raw nerve part. True, the treatment for obesity is indeed expensive, but I would like to say that a stitch in time saves 9. Just look at the larger picture. Obesity is associated with so many problems, so many metabolic problems, infertility, even cancers. So, if we address the problem right at the early stage, we can prevent those expenses which we have to face in future. So, if we do a cost-effective analysis between the one-time cost of treatment for obesity via all these lifestyle problems which eventually are gonna crop up in our lives, definitely the treatment for bariatric surgery will be much cheaper. Also, because of the quality of life which is getting affected, and you can't put a price on that. So I would say that few things in life money cannot buy.
Great points, Dr. Anshuman. I feel like in India, people still don't see obesity as a preventative disease. They see it as aesthetic. And obesity, as we've discussed, results in so many medical diseases like cardiac disease, knee replacement, joint replacement, liver disease. The list goes on. I actually just recently relocated from the US. I was living for 6 years in New York, and funnily enough, in my last flight from New York to India, मैंने देखा कि 60 साल 70 साल के लोग हमारे जो टर्मिनल पे बैठे हैं सब व्हील चेयर्स में हैं. Everyone's in a wheelchair, and the health span of people of Indians is just so low. वहाँ पर न्यूयॉर्क के जितने भी वाइट लोग अंग्रेज बैठे थे टर्मिनल पे सारे 80-90 इयर्स के फ्रीली चल रहे हैं, घूम रहे हैं, they need no support at home, and that just made me so sad to see that India, being the diabetes capital of the world, being the obesity capital of the world, we are so actively suffering from the consequences of it at a much younger age, at a much lower health span. So let's talk a little bit about the hidden costs of obesity, right? How much do you think heart stent costs?
Well, before I answer this question,
Yeah.
I would like to make a point here that we Indians are not able to handle obesity like our Western counterparts. There's a term, metabolically obese, physically fit. So unfortunately, in India, because of all these maybe environmental or genetic factors, we need a lot of intervention at a very early stage, and that is why WHO as well as ICMR is very strict. So we have got very different parameters and more strict parameters. Now, let us answer, coming to your question, a stent would cost somewhere between 2 to 3 lakhs, maybe even more.
What about knee replacement?
Absolutely, between 2 to 4 lakhs, 5 lakhs, depending on the place.
What about IVF?
Again, these treatment, they would require a lot of your energy, your money, lot of mental stress. IVF would cost somewhere around 3 to 5, maybe more, 6 lakhs.
And emotional.
Yes, it takes a huge toll on you at
huge
times.
toll.
Yes.
What about liver transplant?
Well, liver transplant costs somewhere between 25 to 30 lakhs.
Oh, that's really expensive.
That's huge, yeah.
And so these are all, of course, conditions that could stem from obesity. And
Absolutely.
How much do you think bariatric surgery costs?
Well, bariatric surgery, depending on the place and the type, we offer laparoscopic as well as robotic surgery. So bariatric surgery usually costs somewhere between 4 lakhs to 8 lakhs, depending on the comorbidities and type of the hospital and facilities.
Costs wise, अगर हम discuss करें, then तो obviously it rather than get
Definitely.
those diseases, it makes sense to prevent them.
Absolutely.
But not just cost. Like talk a little bit about how it might affect someone's long-term health.
Absolutely, and the best thing is at early you are offering a 360-degree holistic approach, which is the need of the hour, because you have to go holistic on the management of obesity. You need dietary lifestyle management, you need medications, you might need surgery, you will need follow-up. So a 360-degree management, just like you give this 360-degree management in a patient with cancer, similarly, I would say obesity also requires a completely holistic approach, and if you provide them a one-stop shop, nothing like it.
Correct. Yeah. So in addition to what you covered, I feel like there's tracking is also so necessary, right?
Yes.
Tracking of patient outcomes, and not just what they tell you in the weekly time that a nutritionist meets a patient, but on a day-to-day basis. Which is why, at least when I was in New York, I saw all of these apps.
Yes.
There track people on a daily basis. कि आपने कितना workout किया है.
Right.
All of that data flows into the app, goes to your nutritionist and your doctor. आपने what your smart scale metrics, body composition, right? What is your visceral fat? How much is your muscle mass? Or that is tracked on a weekly basis because you have a smart scale. We send you a smart scale at your home, and that is tracked. How much have you eaten? Your calorie counting, your meal logging. I feel like the tracking begins at home because people are like, "अरे मैं तो कुछ खाता ही नहीं हूँ, मैं तो कुछ खाती नहीं हूँ." But when you actually log those meals and you count them on a day-to-day basis, your coach and your doctor can really help support you and find out the real causes or the main lifestyles that you need to change. And that I feel can only be possible if there's a technological element that is reminding you to and gamifying in a gamified way, suggesting or nudging you to take the right steps in the right direction.
Absolutely. So rather than a passive monitoring, or if we expect motivation from the patient's perspective, it is always better than an active surveillance, active monitoring like what you guys are doing. is going to help in getting the desired outcomes, especially with the use of these apps, these telemonitoring, data analytics. You can make intervention at the right time,
Correct.
Leading to excellent results.
Correct. No, that's what we try to achieve. What we also try to achieve is we deliver medications from the most reputed, trusted sources. Like until now, until the launch of GLP-1s, people were actually importing Mounjaro, Ozempic, all these medications from abroad, from Dubai. Even now, I feel like they are a lot of times this product is a cold chain product, right? So
True.
not breaking cold chain becomes such an important part.
Absolutely.
So we make sure that the medicines are delivered in the most safe way where the cold chain isn't broken, and we tie up with the best companies in this case. So it comes from reputed sources, and of course doctors need to spend not 2 minutes to write a prescription, right? They need to have a 20-minute, 20-minute at least holistic consultation on a monthly basis, where doses can be escalated in a scientific manner, where these are super highly trained doctors from the best schools, AIMS, Safdarjung, RML, Gangaram, who we have on our portal. I feel like a holistic understanding of patient outcomes is so necessary when it comes to the treatment of obesity, especially if done using GLP-1 medication. So, Dr. Anshuman, what are the changes that you've seen in users who've used medical treatments to reduce weight?
Well, to start with, not only a person would become healthy, but there are so many mental changes as well, which we notice. A person becomes more positive, the depression is completely gone, a person would become more social. In addition, there is reversal of comorbidities also. For example, if a person is on insulin, the doses gets reduced. Also, there is improvement in obstructive sleep apnea, snoring, tiredness, fatigue. Also, the cardiovascular risk profile also increases a lot. Joint pains completely disappear if a person is losing more than 10% of the weight. Infertility also improves, and we have seen patients getting conceived after losing weight on these medications. So the effect on a human being after losing weight, so I would say the effect is seen everywhere. Not only the health, but also the mental health part improves, as well as the physical aspect gets better.
I often hear this, Dr. Anshuman. I feel beautiful the way I am. Why should I lose weight?
Parth, I can only say that body positivity and health protection, these are two different things and they can coexist. Here we are talking about treating a health issue.
That's right.
We are treating not only obesity, but many lifestyle related disorders which a person gonna get in future. So though you may feel beautiful, but here we are addressing the problem of health. So these are two different aspects of the coin, and that is why it needs to be treated.
So Dr. Anshuman, we discussed so many side effects of Ozempic, of GLP-1 medication. How do we manage them?
Well, I can only say that these medications should be taken under strict monitoring, under observation, and there should be regular follow-ups, because you should not be losing muscle in place of fat. You should be taking adequate protein, adequate fiber, adequate fluids to maintain the muscle mass, the glow on the face. So again, it needs a comprehensive management, and I really admire your effort in ensuring that.
Completely agree. I feel like losing muscle mass is probably the biggest side effect,
That
in
is the
my
problem,
opinion,
yes.
of taking GLP-1 drugs. And that certainly countering that is where a holistic program comes in, where you're eating right, a nutrition or an exercise coach helps you work out, motivates you. And there are other side effects as well. For example, on the liver, kidney, other parameters that we test for upfront, right? There need to be lab results that are conducted before you
Yes,
start
absolutely.
medication as well. Certainly, side effects can be treated, can be managed under the right super specialized doctor care.
Absolutely. Do not self-prescribe. Do not self-indulge in these medications.
इंडिया में तो सब कुछ ही मिल जाता है केमिस्ट पे, schedule एज ड्रग्स भी मिल रहे हैं केमिस्ट पे, बट एब्सोल्युटली नहीं लेने चाहिए. Not just risky medications like GLP-1 drugs, but even antibiotics, I would. So in that case, what would you say to people who are considering this but kind of on the fence about medical therapy?
I would strongly recommend that if your BMI is more than 27, or if you have metabolic issues or comorbidities, then just don't sit at home and wait for some miracle to happen. Take action. You may contact early, which will take care of your health in a very comprehensive manner.
Or if you're in Delhi NCR, you should contact Dr. Anshuman if you're looking for weight loss consultations, including bariatric surgery. Thanks for gracing us, Dr. Anshuman.
Thanks for having me, Parth. It's an absolute pleasure being here with you today.
If you've tried everything, आपने diet किया है, exercise करी है, आपने supplements ले लिए हैं, and you still haven't lost weight, or that weight has bounced back, you could be suffering from an underlying medical condition. Let's diagnose that and let's rectify that. If you have a BMI above 27, contact early. You might be eligible for GLP-1 medications. Contact us down below.